Welcome, esteemed healthcare professionals, students, and those with a general interest. This is Dr. Tristan Valor. I have the honor of guiding today's short lesson that has been crafted by my good friend Corey Williams. Today, we delve into the world of phlebotomy, an often underappreciated yet vital part of healthcare. Phlebotomists, like nurse assistants, do the hard jobs many others straw away from. Yet those who truly have mastered this art are never given the recognition that is due. Phlebotomists, medical laboratory technicians, and medical technologists draw blood samples and collect other specimens that enable diagnoses and guide treatment plans. Their role, while seemingly simple, involves a deep understanding of anatomy, precise technique, and a compassionate bedside manner, and the ability to move independently or toll with a team of like-minded individuals to accomplish their goal. As we proceed, you will gain a deeper understanding of the intricacies of this essential profession. Before any blood draw, preparation stands as the first crucial step. Without proper preparation, even the most skilled phlebotomist may encounter unnecessary challenges. It all starts with hygiene. Ensuring clean hands isn't just about washing, it's about scrubbing, rinsing, and drying thoroughly. It's about using an alcohol-based hand rub when water isn't available. Next, the gloves. Always remember, gloves are not a substitute for hand hygiene. They're an extra layer of protection. After gloves comes the environment. It should be clean, well-lit, and free from distractions. The equipment should be ready and within reach. A phlebotomist's preparation doesn't just end here, it extends to the patient. Making sure they are comfortable and informed, it extends to the phlebotomist, ensuring they're focused, calm, and ready to perform their task with precision. Remember, a well-prepared phlebotomist is a successful one. Identifying your patient correctly and establishing clear communication is paramount. This is the bedrock of any successful phlebotomy procedure. It's simple yet crucial, like a key that opens the door to effective healthcare delivery. Now imagine this. You're about to draw blood from your patient. You've washed your hands, you've gathered your supplies, but there's one more step before you proceed. Patient identity verification. This is not just about confirming the patient's name or date of birth. It's about ensuring that the right person receives the right test at the right time. It's about safety and accuracy, and it doesn't stop there. Clear communication is equally essential. It's about explaining the procedure, addressing concerns, and obtaining informed consent. It's about making the patient feel comfortable and involved. Remember, the patient is not just a name or a number on a lab form. They are people. They are partners in care. Patient identification and communication form the foundation of trust in any healthcare setting. Venipuncture, the art of drawing blood, is a skill that requires precision and care. Right after selecting the site, which is usually the inner elbow area or antecubital fossa, an important step is to ensure cleanliness. Here, alcohol swabs are crucial. The site must be wiped only once with an alcohol swab to disinfect the area. Just remember, let it air dry. We don't want to rush this process. After making sure the area is clean and dry, we can proceed to the star of the median cubital vein for its prominent characteristics and less likelihood to cause discomfort when punctured. Next up is needle insertion. This isn't a dart game, folks. The needle should be inserted at a 30 to 45 degree angle with the bevel up, ensuring minimal discomfort for the patient. A successful insertion usually yields a flashback of blood, signaling the vein has been accessed. Speaking of patients, comfort is paramount. A confident, gentle approach can alleviate anxiety and make the process smoother. After all, a relaxed patient means more stable veins, and that's a win for everyone involved. Mastering the venipuncture technique, the crucial step of using alcohol swabs correctly, is a mark of a skilled phlebotomist. The order of draw is not arbitrary, but a well-established protocol. You see, each blood collection tube is designed with a specific purpose in mind: to preserve the integrity of certain types of blood components or to facilitate certain types of tests. For instance, some tubes contain additives that prevent blood clotting, making them ideal for testing blood cells and platelets. Other tubes might have a gel that separates serum from cells, useful for chemistry tests. Moreover, the order in which these tubes are filled during a blood draw is not a random sequence. It's a carefully designed order that minimizes the risk of cross-contamination between the different additives in the tubes. It's like a well-choreographed dance where each step is crucial to the overall performance. And why is this so important? because keeping to this order can be the difference between an accurate diagnosis and a misleading result. Adhering to the correct order of draw ensures accurate and reliable results. Staying updated with best practices is a continuous learning journey. In the fast-paced world of healthcare, it's essential to keep one's knowledge up to the minute. This is especially true in phlebotomy, where advances in research and technology can dramatically improve patient outcomes. Every day, researchers are discovering new ways to enhance the effectiveness of venipuncture, minimize patient discomfort, and improve the accuracy of test results. As a phlebotomist, it's your responsibility to stay abreast of these developments and integrate them into your practice. Training programs, seminars, and professional literature are great resources to stay informed. But it's not just about learning, it's about applying what you've learned. The best practices are worth little if they're not implemented. So whether it's a new venipuncture technique, a more effective way to communicate with patients, or a better method to prevent cross-contamination, never stop learning. Never stop improving. In phlebotomy, as in all healthcare professions, knowledge is power. Sample handling dictates the integrity of test results. Proper handling is a delicate dance that begins with collection and ends with analysis. The first rule of this dance: maintain sample integrity. Every sample is a treasure trove of information, but mishandle it, and you might as well be reading tea leaves. Also keep in mind that every careless error is a loss of money, time, and possible litigation depending on the situation. Prompt processing is key. Remember, time is of the essence. Delays can lead to sample degradation, compromising the accuracy of test results. You wouldn't want a delay in a ticking time bomb, would you? Well, every sample is a ticking time bomb of information waiting to be discovered. Storing samples at the appropriate temperature is paramount. Too hot or too cold, and you risk damaging the sample. Imagine Goldilocks: not too hot, not too cold, but just right. And of course, samples should always be handled with clean, gloved hands. Contamination is a no-go. A well-handled sample is the first step towards accurate diagnosis. Quality control is the backbone of reliable lab results. It's what separates a laboratory that's merely functional from one that's truly exceptional. Quality control isn't just about ensuring that the machinery is in working order, it's about a commitment to precision and an understanding that even the smallest deviation can have significant consequences. Consider equipment calibration. This process, which adjusts the output or response of equipment to align with a known standard, is crucial for maintaining accuracy in the lab. Regular testing, too, plays a vital role in quality control. It's not enough to assume your equipment is functioning correctly. You need to verify it. By conducting regular audits, maintaining transparency in your processes, and keeping meticulous records, you're not only ensuring the accuracy of your results, but also building trust in your laboratory. In a field where accuracy is paramount, quality control is key. Remember, quality control ensures the credibility of your laboratory. Now onto something rarely discussed. Every now and then, the phlebotomist must be able to deal with an irrational, mean-spirited, violent patient who may make those few minutes with them difficult. Always stay professional, document anything that gives you pause, and use exacting clarity. At times, some patients will test your resolve, so if you need to, speak with their nurse, the doctor, your supervisor. Sadly, many unfounded allegations have led to job loss and/or suspension for employees on mere words with no evidence, so always use common sense in these situations. This is especially true if the provider is male and the patient female. Always stay safe and professional in your work. As we conclude, remember the importance of your role as a phlebotomist. Your meticulous preparation, accurate patient identification, and proficient venipuncture technique contribute significantly to patient care. Your dedication to staying updated with clinical practices, ensuring sample integrity, and preventing cross-contamination is commendable. Your commitment to quality control, effective team communication, and continuous lab improvement is invaluable. In this journey of healthcare, your role as a phlebotomist is pivotal. Always strive for excellence, as your work directly impacts patient care and outcomes.